there, my name is Finn, and I live in the Charlotte R. Bloomberg Children's Center. Lots of children come to Johns Hopkins Hospital every day. Some of those children are here to have surgery, like my friend Kendall. She wanted to share her story with you so that you would know what to expect when you come for your surgery. At the end of this video, there is a telephone number you can use if you need more information before your surgery.
Hi, my name is Kendall. I came to the hospital last week to have surgery. I was feeling pretty scared before my surgery. My mom says that's pretty normal. I'm at home now and I'm feeling much better, and I wanted to show you some photos of what my day was like. This is me and my mom taking the blue elevators to the 4th floor of the Bloomberg Children's Center. Did you notice the big picture by the elevators? All the ideas for the artwork around the hospital came from children's books. See if you can guess what books they are from. When my mom and I arrived at the 4th floor, we checked in at the front desk. The receptionist gave me a bracelet with my name on it. We then sat in the waiting area until the nurses were ready for me. The nurse brought us to another room called the pre-op room. That's short for pre-operational, which means before surgery. I could see a lot of other kids who were coming to have their surgery, but I had my own space that had a bed, a TV, and chairs. The nurse gave me some hospital pajamas to change into. All the kids wear these because they are very clean, and that's very important when you have surgery. Then she checked on how much I weighed, my temperature, blood pressure, and pulse, and listened to my heart. There was a fun playroom nearby. I was feeling hungry because I wasn't allowed to eat or drink anything. This is a rule for all kids who are going to have surgery. Playing in the playroom really helped me forget about being hungry and helped me feel less scared about my surgery. The child life specialist helped me know what to expect. We played and practiced using medical equipment on my toy dog. She showed me different ways that I could feel more comfortable, like taking deep breaths and thinking about happy things. After I had the chance to play for a while, I got to see my surgeon. That's the doctor who helps make things in your body better. My surgeon talked to my mom and I about what to expect during and after surgery. I was wondering how I might feel after surgery, so I was glad that I got to ask that question. After my surgeon left, I got to meet my anesthesiologist. That is a really big word for the doctor who gives medicine that makes it so you don't feel, hear, see, or smell anything during surgery. This doctor stays with you the entire time of your surgery too. Sometimes anesthesiologists are called sleepy medicine doctors. The sleepy medicine doctor listened to my heart and lungs. The sleepy medicine doctor talked with me and my mom about how I would go to sleep with medicine using a see-through mask. I got to pick out a flavor to help make my mask smell good. Did you notice that all the doctors are wearing blue caps and have paper masks around their necks? This is because the rooms where surgeries are done, called operating rooms, are really clean and germ-free. They wear these outfits so that no germs are spread. When it was my turn to go to the OR, my mom also had to put on a cap, gown, and mask. You can choose an adult to go with you to the OR too. The operating room nurse, who stayed with me the whole time, showed us the way to the OR. When we arrived in the operating room, I talked a little more with the nurse, and then my mom helped me lie down on the bed. My mom was right by my side, but I was feeling a little nervous, so she reminded me to take deep breaths like I practiced with the child life specialist. The nurse put some stickers called EKG leads on my chest. These help the anesthesiologist know more about my heart during surgery. She also put a sticker on my finger called a pulse ox that helps the anesthesiologist know more about my breathing during the surgery. The anesthesiologist and nurse gave me the sleepy medicine through the mask. My mom was by my side the whole time. It's a little hard to remember, but my mom said it only took me a few deep breaths before I fell asleep. Once I was asleep, a nurse walked my mom out to the waiting room where she would stay during my surgery. The nurse let my mom know that they would call me from the OR with updates and showed her the TV screen that would say when my surgery was done. When my surgery was done, the doctors took me to the wake-up room. My mom was there with me. When I was asleep, the doctors put a little tube in my arm called an IV, so I didn't feel it at all. The IV is an easy way for my body to get medicine. The nurse asked me how much I was hurting on a scale of 0 to 10. I said 5. Then she put some medicine in my IV. The medicine helped me to feel better. The nurse gave me some juice to drink and a popsicle to eat. When I was feeling much better, my nurses and doctors said it was time for me to go home. Sometimes kids have to stay in the hospital after surgery so the nurses and doctors can take care of them for a little longer. You can ask your doctor if you have to sleep over after your surgery. I got to ride in a wheelchair to my mom's car because I was still feeling a little sleepy. I was happy to be going home.